Guard your heart because everything you do flows from it. Hello and welcome to our show. I am Harsha Sinha. A healthy heart leads to healthy body. And if we talk about the major risk factors for heart disease, then the prime example can be high blood pressure. This vital organ is programmed to work automatically for every second of every day, no matter what else you are doing mentally or physically. In other words, your heart never rests. In our previous episode, we discussed about how to keep your heart healthy. And today, we'll find out more best ways to do so. Joining me in the studio is Dr. Purshotam Lal, who is the chairman at Metro Group of Hospitals, New Delhi. He is also a Padma Vibhushan Awardee. Welcome to our show, sir. So let me start with a very basic one. What measures can be taken to keep our heart healthy?
Well, simple. Maintain the weight, which is done by the diet and exercise program. And as long as you do the daily exercise, good diet and maintain your weight, 50% of the heart problems can be handled and you can keep your heart very healthy. Now, that's really the key. Now, along with that, I would like to add here that if you can avoid few of the things, most importantly smoking, excess of drinking, fatty foods and proper control of diabetes, high blood pressure, cholesterol, and this is more important if there is a strong family history of heart disease. In such situations, taking precautions becomes very important. So, the key, as I said before, is to maintain the ideal weight by proper exercise program as well as the diet program.
Okay, so if we are talking about the diet program, so I would really like to understand from you what diets can we include?
Well, see, we always encourage vegetarian diet full of fruits, vegetables, but really the key, how much you burn the calories.
Definitely.
You know, in olden people, they used to even take a lot of ghee and still they will live, you know, above 90, above 80, so forth. So, I think if you are doing good exercise, you are burning your calories, even if you eat more or little diet, you know, containing even partly ice cream, those kind of things are acceptable. But generally to our heart patients, we say that avoid fatty foods, avoid saturated fats, trans fats like cake and all those pastries, so forth. And along with that, a lot of the meats, red meat, so forth, need to be avoided. But the best person for the diet comes the dietitian, you know, and I always tell my patients or even the individuals who come for healthy checkup to get the opinion of a dietitian.
Okay, so basically good diet is really very important.
Absolutely.
And if we talk about the exercise, so what should be the timings? Because you know nowadays life is so very busy that you know we hardly get any time to have exercise also. So what can be that very simple and short exercise?
Well, exercise has to be done, you know, no matter how much anybody is busy,
Okay.
you got to find the time. That is the most important, non-expensive way to keep healthy, not from heart point of view, from all the other areas. So, for exercise, the shortcut should be avoided generally, and I would
As
say,
we say that there is no shortcut to life and there is
well,
no shortcut to
you
health
know,
also.
I mean, exercise you got to do it. Now, it depends upon the people. Some people
You
like
should always
to,
have your me time, right? And the
some
exercise
people-
is really very important.
Absolutely,
Okay. So I would like to also understand from doctor as well, what immediate action must be taken if a person suffers from heart attack?
Well, you got to see where you are, you know, I mean, when the heart attack takes place at the residence or even for that matter in the office, now we have to see to go to the nearby, hospital or a facility where such kind of things can be taken care. So, ambulance services, usually people know these days the number for emergency services. If ambulance service is not available, you may be having a friend, a neighbor who can put you in the car to take over there. Try not to drive yourself, because that is the time when there is a great need of oxygen. And we always tell our patients that they should not go even upstairs, and sometimes they feel good, they go upstairs, they walk to the ambulance. Those things should be avoided, and to reach to the facility right away as soon as you go, because we always say the time is muscle. If you go to the hospital very soon, and if the doctor find out there is a problem or there is a facility, what we call cath lab, and where we can find out that if the artery is totally blocked or something, and we open it well in time, say within 6 hours, I think there is no damage. This is the beauty of going to the hospital or a facility, preferably which is advanced, but you don't have to go very far away to get that, because even a nearby.
We need to find the nearest
That's
hospital.
right.
Okay. So, if we talk about the CPR function, so CPR, how does CPR play a great role while a heart attack occurs?
Well, CPR really helps. We say basic life sport. You have to know how much you have to press and count and mouth to mouth breathing, and those kind of teachings should be done in all the offices. And we also make sure that our people know at least the basic part, even though there is advanced cardiac life support situation is available to the doctors, but CPR can save the life,
save anybody's
can
life,
save the brain, can save the heart.
Save the heart and life as well. All right. Doctor told us how CPR can be performed to save life. So, I would also like to understand from doctor, what risk factors should be strictly controlled after a heart attack?
See, once the heart attacks take place, afterward, what are the things we have to control? And obviously, we go toward the risk factors. Like somebody smokes, we tell them not to smoke. Proper control of the diabetes, proper control of the blood pressure, exercise program. Again, depending upon whether the heart attack was major, what is the efficiency of the heart, what is the size of the heart, all those things a doctor can see. Or sometimes we can do, after say 6 weeks of the heart attack, a controlled exercise program, and we can find out how much the person can do from exercise point of view. I always encourage the walking. Walking is the best way to do after the heart attack, before the heart attack, or otherwise. This is the best way to go.
Walking is really important.
Yes.
As you say, exercise is also
Yes.
very important. Okay. So, how often a person should go for a heart checkup?
Well, there is nothing very fixed about it. We see, a doctor can evaluate whether somebody is a low risk, high risk. Let's say we are talking about 30 years age, Now, if somebody is high risk, there are risk factors, the person is smoking, strong family history, obesity, and those kind of things, in those cases we say that you get your heart checkup, even every year. But if there is no risk factor, the person is very healthy, from 30 to 40 years, you can get it done, every 2-3 years, depending upon the findings. After the age of 40, we usually recommend every year, and sometimes people 40 to 50 every 2 years, and then comes the role of annual physical checkup after the age of 50. But in other country, and even in our setup, we like to do these kind of checkup every year after the age of 40.
Okay. So, if we talk about the diabetic persons, so how they are affected by a heart attack, I would like to understand from you.
But diabetes is a disease which not only affects the heart, you start from the head till toe, your brain gets affected, your heart gets affected, your kidney gets affected, your legs, arteries. It is the process of atherosclerosis, and diabetes. This is very extensive. Unfortunately, in our country, the diabetes mellitus is the major cause of coronary artery disease. Now, we see our patients, every third, fourth patient, or to me look like every other patient. If it's real heart patient, invariably there is evidence of diabetes. So, very important to get the checkup for the diabetes and to get the proper treatment. And when we talk about the treatment of diabetes or the heart problem, the whole thing revolves around the same, is the maintaining of the weight with proper exercise and the diet. That's how we go about.
Okay, and if we talk about the clear definition of a heart stroke and heart attack, so how can we differentiate? Is it different or it is the same?
Stroke, we talk about brain attack.
Okay, yes.
And heart attack. And risk factor, of course, are mixed, like in stroke, we see the artery of the brain get blocked. In the heart attack, the artery of the heart get blocked, and the risk factor more or less are the same. And stroke affects more elderly people, and there is a formation of blood clot, or it could be due to hemorrhage, or there could be long blood clot or spreading of the blood clot, what we call embolic phenomena coming from the heart, coming from the leg through the heart, that kind of thing, that can give rise to stroke. But we for stroke also advise to reach to the hospital very soon. For the heart also we advise. As a matter of fact, the time, the window for the brain or for the stroke is even smaller than the heart, and we like the patient should come within an hour. And if we give blood thinners to the brain stroke patients, within 4 hours we can get substantial recovery. Of course, it varies patient to patient.
Okay, it depends on patient to patients. And I would also like to understand that if in case of alcohol usage, how it is severely hit?
If the alcohol is taken in moderation and the person is doing exercise every day, I don't think alcohol will do much harm. But here it doesn't happen. Hardly time, as you said in the beginning, that there is hardly time due to the fast life and targets and so forth. So, people end up drinking, but no time for the exercise, pure drinking, and that also in more amount can do the harm to starting from the brain, heart, liver, whole body. So, there are certain things which can be better if they are taken in the small quantity.
Okay. So, these are the measures which alcohol addicts can really take care of.
In moderation.
In moderation, all right. So, we discussed about how physical activities can help an individual to keep his or her heart healthy. We will discuss about BMI, that is body mass index, but on the other side of this break. Welcome back after the break. You are watching Healthy Heart episode, and we discussed about the measures to keep the heart healthy and the heart checkups as well. So let's continue with Dr. Purshotam Lal, who is the chairman and director of Metro Group of Hospital. Also, he is a Padma Vibhushan Awardee. So doctor, does maintaining BMI is very essential to keep our heart healthy?
Yes, of course. Basal metabolic rate is very important, but we look into that how how it is good. The whole thing boils down to same good amount of exercise, maintaining the weight. Weight is very important, and when you maintain the weight, the diet becomes very important, and you have to drink a lot of fluids, good hydration, what we say, and all these three factors can keep the BMI in a good shape, and which is good for the heart and good for the whole body.
And if we talk about the obesity, I mean, how people can, I mean, treat their weight gain, because day by day they are gaining weight. So any solution from the doctor?
See, the weight is a very big problem because the issue comes how much somebody does the exercise and how much somebody eats. So there is a disproportion.
But many a times it is found that I mean, patients who do not eat, I mean, people who do not eat, they are also gaining weight.
Yes.
So
now, then there is a group of people. If you ask their history, they are not eating much. At least they feel
exactly
that they don't eat
point.
much, but still we are gaining weight. And those are the patients, they need a real clear history, good checkup. Sometimes they can have a thyroid problem, and sometimes you have to see their lifestyle. They hardly walk or they hardly do the exercise. But then I agree that there is a group of people who do good amount of exercise, watch the diet, but still they gain. Now, there are many factors. One of the factors is the genetic, runs in the family. Some are lucky bodies, some are unlucky bodies.
Definitely, the unlucky and the lucky bodies.
When there is an unlucky body, they hardly eat, and still the weight is much, and there is a lucky body, they can eat 6 chapati, 8 chapatis, and then everything goes fine and dandy for them. Now, what we do, in those cases, in the very exceptional cases, there are certain areas where the fat deposition takes place. No matter how much exercise you do, it's areas which are resistant to the exercise, but invariably I have come across, I am sure a lot of other people have come across, that when the people really follow the diet, they really do the exercise, and suddenly they tell, oh, I lost 10 kg, suddenly they lost 8 kg. Now, there are various kind of diet programs are available, but the key remains the same. I mean, like we worship many God, but God is one. I mean, here you follow any kind of diet. Some people liquid diet, fruits, this, that. The whole thing boils down to amount of the calorie and how much you burn, and this is that particular ratio which helps to maintain the weight.
Okay, so we have discussed how to maintain the weight. Okay, so if we have discussed about how to maintain body weight, I would also like to understand from doctor, what is a good cholesterol and a bad cholesterol? Is high cholesterol hereditary?
Well, good cholesterol we call HDL, high density lipoprotein, and bad cholesterol LDL, low density lipoprotein. Now, HDL usually we like that it should be more than 40, and LDL we want that it should be less than 100. Now, HDL when it is high, it means it protects your heart, it protects the formation of the deposits, and the bad cholesterol the other way around, it creates the deposit, creates the blocks. I come across many patients where LDL is way high, no matter they are fit and they do everything. Now, that is a very genetic problem. We have to look around where nothing is working, but those are the special cases where we consider some sort of medicine. Otherwise, if the LDL is high or the HDL is low, I do not recommend any medicine that easily, and because those medicines they have the side effects. So, the best part to increase the HDL, even though it is not documented, again come the long walks. If you do the long walk, some people say, oh, you take 1 or 2 drinks or preferably wine a day before, then you do the exercise, HDL increases. I mean, maybe, You know, there are certain papers to support that. But in my practice, you know, if HDL is way down, I ask them one question: do you walk at all? They say no, susti pad gayi aajkal. You know, I mean, so walking does help in increasing the HDL, you know, and how much I cannot say, you know, and the same is in the LDL, and if it is very high, we have to consider the medicine. Otherwise, for moderate high, please follow the diet, follow the exercise program, and repeat the blood test before anybody can think of giving you the medicine.
Okay, and if we talk about the cholesterol, because you know generally people relate cholesterol with the heart attack and heart disease. So how soon the cholesterol level can be checked up?
See, cholesterol have definitely linked with the heart disease. When we are talking about LDL more than 200, or the family history of heart problems, those kind of situations, it is linked. But you will be surprised, in India, we see a large chunk of people where the cholesterol are just fine, you know, and then also they get the heart problem. So, I think in India, we need to do lot more research to find out the more risk factors than the other conventional risk factors, you know, like what we are following it, you know, diabetes, high blood pressure, smoking, obesity, lifestyle, so forth, you know, like the Western country. But in addition to that, in India, I feel there could be something to do with the food, there could be something to do with the excessive smoking or something which happens in the villages, because we are getting more and more young people with a heart problem and coming from the rural areas, you know. It is the other way around. We used to think, you know, the people living in the rural area, they work more and they
are very cool and composed, and they are relaxed also.
Yeah, that's right.
Okay, and but
yes.
but the case is different. So you are facing, I mean, many people coming for
yes.
who have heart disease are from rural areas only.
Absolutely.
I mean, why is it so, and why not
why
from the urban areas? Because we generally
well,
deal with, you know, lots of stress.
There is some awareness factor, which is good, you know. Urban people are following as compared to people who are living in the villages, and there is a less teaching around in the villages, and the people who live in villages, we are seeing them with sudden heart attacks, you know. Okay. That's another thing. We will say that they are away from the prevention, you know, which is a sad thing.
So basically, this can be a knowledge issue for them.
Absolutely.
That is what you said.
Yes.
Okay. So does a sleep apnea, which is a serious disorder in which a person briefly and repeatedly stops breathing during sleep, leads to a heart attack or not?
See, sleep apnea means that you stop breathing while sleeping, you know. And it happens many times during
I beg your
sleep.
pardon. We don't sleep while we don't breathe while we sleep. Did you
No,
say that?
it's a suddenly stopping of the breath.
Suddenly stop? Is it like that?
Yes. You're, you know, you see the people who snore, and while snoring, all of a sudden they will take a long snore.
Definitely.
And then, you know, they can even get up momentarily and they go back to sleep, and this happens many times. So, sleep study, particularly in obese people where there is a shortness of breath, and the one who are snoring a lot, the sleep study is very important, you know. And there we find out with the sleep study what is their oxygen level. Now, these kind of traumatic things do contribute, you know, one of the risk factor toward the heart. And we always.
Why does it happen to few people? I mean, why do few people only snore, and why not the others? Is it also a disorder?
As I said, that, you know, it's only the obese people, you know, generally they snore, or if there is any anatomical problem, you know, sometimes there can be problem with the in the nose, you know, the septum is deviated, or some other problem. But what we see generally is people who are a bit overweight and who do very less exercise, and these are the people. And so first thing we ask them, do you snore? You know, and
And they say no,
always,
we don't.
you know, the spouse is sitting by and they say yes.
Yes, he does.
Of course, yeah.
Okay, so basically sleep apnea is
That's
a
right.
basic
so
disorder.
the people who suffer from sleep apnea, they should get the sleep study done, and after evaluation of the sleep study, sometimes they need special instrument, special machine called a CPAP, and believe me, this CPAP sometimes it changes the life of the people, you know, if it is done, you know, if it suits to the people or the evaluation is done properly, it's a big blessing.
Okay, so basically a sleep study and an evaluation is also very important.
Yes.
Okay, so does high intake of birth control pills by women leads to a heart attack?
Well, technically, yes, high amount of birth control pills can lead to more atherosclerosis, but you know, the age factor, you know, usually the birth control pills during the time when it's taken, you know, during that period, you know, there is a lot of protection done by the hormones, and I would say the heart problem is a very less. So, in other words, I will not blame birth control pills toward heart problem, but certainly it can be one of the risk factors if taken in excess amount.
Okay, so basically we spoke about the birth control pills. I would also like to understand, how do you treat your heart patient?
See, first of all, if I get a heart patient, I have to diagnose, you know, whether there is any block in the arteries, for which we do the some non-invasive test, echocardiography, TMC, etc. And then we go toward the coronary angiography, we find the blocks. Now, there are 3 arteries of the heart, and we find out how many blocks in which artery, what is the location. And there are 4 kind
how
of.
does the artery gets blocked? What are the main causes?
Well, the main cause which we have discussed, you know, is usually the fat deposition is the main cause, and once we know that there is a block, then we have to see how we can treat it, as your question is. So, there are 4 ways we treat. There is one group, we tell them that we do the angioplasty, we can put the stent and to treat it. There is another group where we do the surgery, bypass surgery. Then there is a third group, majority of the patients fall in the third group, that either angioplasty or the bypass. It depends upon the, you know, how many blocks, the competency of the doctor, and from where the patient is coming from, all these factors, you know, and if the blocks are multiple or the arteries are totally blocked, so forth. And lastly, the medical treatment. So, generally this is the kind of management of heart patient comes. Now, if patient comes with a heart attack, and then we have to open the arteries on emergency basis. Generally, the lot of people ask the role of disprin. One thing I will tell, disprin is one of the blood thinner, and once the doctor prescribes, depending on the risk factor to anybody, disprin is of great help.
Okay, so basically these are the ways to treat your heart patient. Strengthen the muscles of your heart by getting regular exercise. As with other muscles, your heart muscles become strong when they are made to contract and release repeatedly. This keeps your heart beating nicely. So if we want to live a healthy life, we have to take care of our heart. So that's all for today. We'll be back with many interesting stories in our next episode. Please write to us and let us know your feedback on feedback@indiascience.in. I would also like to thank Dr. Purshotam Lal for coming in our show and making our viewers understand about how to keep our heart healthy.
Yes.
Thank you so much, Doctor.
Most welcome. Thank you.
So thanks for watching.